The Nova Scotia Nurses Union is the latest group to respond to planned changes in the province's healthcare system. Now, dozens of emergency room doctors have also signed an open letter. The groups say the province's changes don't go far enough in addressing the problems, the types of challenges brought into focus recently by the deaths of 2 women who endured long ER waits. Brett Ruskin is on this story in Halifax.
Yesterday, we had that major announcement from the government. Today, we have response. So, most recently, the Nova Scotia Nurses Union put out a response letter talking about how they are happy with the overall all-hands-on-deck approach that the government is taking to try to fix the major issues that we're seeing in Nova Scotia's emergency departments. However, there are a series of steps, a series of items and issues that could be resolved according to the Nurses Union. First of all, there was nothing in yesterday's plan necessarily, according to the union, to address the significant vacancy rates that we're seeing. CBC News has reported on the 80% vacancy rates in some units in some hospitals. Speaking of workload, the union wants more administrative tasks removed from the shoulders of nurses so that they can focus on delivering key quality emergency medical care. They also watched yesterday's announcement, saw that there was tuition relief being offered to paramedics coming out of school if they were to sign up to work in Nova Scotia for at least 3 years. That those paramedics would be offered $11,500 for agreeing to work here. The nurses want that same treatment, that same incentive for their membership as well. And lastly, the Nurses Union wants more power given to the nurses to prescribe new or different or more medications so that they can kind of ease some of the strain, ease some of the pressure off emergency departments, because many people are presenting at emergency rooms simply to get prescriptions refilled or renewed, and they're going there because they simply don't have a family doctor who they can go to instead. There was also a response, a second letter that was sent, signed by 40 different emergency room doctors across the province, saying that they're happy with the government's acknowledgement that they are addressing the significant issues in emergency rooms, but that the focus really needs to be on freeing up spaces in emergency rooms to keep that waiting room flowing through so that they can address and triage properly the patients coming in. Also today on the schedule, we saw Dr. Robert Strang, Nova Scotia's Chief Public Health Officer, speaking with a number of other health officials before Nova Scotia's Standing Committee on Health. So really, with all the different items being talked about on the public's agenda, the government agenda here in Nova Scotia, health truly is on the minds of many Nova Scotians, if not all Nova Scotians here in this province. Brett Ruskin, CBC News, Halifax.